That's a really important thing to realize.
Yeah.
Because I know recently they've been talking about even having face masks that actually are clear in the center, so for NICUs and things like that, because our children are being, or these young children are being raised now with much less visuals because of the need for masks.
It's the same thing in the daycares.
Yes.
As I understand it, however, those clear masks are wonderful. It's a great idea, but as I understand it, they aren't approved by Health Canada yet.
No, they're not yet. No,
I'm not aware of any that are approved yet. So it's tricky, right? I guess if you're working in a low risk situation, with healthy people, it's where a cloth face mask would be fine. I guess probably the clear ones would be fine. Yeah. But in a clinical environment,
you need to make
sure
you
have more restrictions, right?
Yes, exactly.
So, yeah. So some other advantages that I found online is that I am 100% hands-off, obviously, because I have to be, right?
Yeah, that's correct.
Most of us have a bit of a hard time sitting on our hands when we're working with parents, as we should be doing, right?
Yes.
But, like everybody else, I have a hard time doing that sometimes.
Yeah.
But of course, online, I can't touch.
Yeah. So you're actually having to use your communication skills so much more, and they are critical.
Very much so
for our role. So I think that's a really important.
Exactly.
Important point.
The other thing that has been helpful, because I still have to try to get a sense of what's going on in baby's mouth, right? To try to find some way to do an oral assessment. As much as you can do online. So what I do, what I found has been helpful, is I actually demonstrate a little bit with the doll first, roughly what we're going, what needs to be done. And I ask mom to do the exam. I teach mom how to do it.
Yeah.
And then I actually have a video that I share of an exam. And again, I talk through explaining each step. And then I have mom do it with her partner, filming. And again, I'm walking them through step by step verbally. So I found that in most cases, I've been really able to see what I need to see to be able to determine, whether or not baby has any signs of, tongue ties or musculoskeletal tension or anything like that might indicate that there's a need for a referral.
Yeah.
And I found that it's actually, it's been helpful for moms to be doing it themselves instead of me doing it, because then they actually see what I'm seeing. And they understand a lot better about what's going on. And because I'll ask them, okay, so tell me what you're seeing. Tell me what you're feeling. How does it feel? Is it easy for you to lift up the tongue or the lip? Is it hard for you? Are you feeling there's a big speed bump or not? And so they're getting a much better understanding of what's going on and why baby can or cannot do what they're supposed to be able to do.
Yeah.
So it's been helpful in that regard.
Yeah, so in reality, you're actually empowering parents to be able to have a much better idea what's going on with their infant. And so when decision making is being done, they're very much part of that decision, which in reality is what we should be doing in general in our role.
Yeah,
so
absolutely.
That's really, really great. That's excellent.
Yeah. Some parents are a little bit squeamish about getting in baby's mouth. And of course, as gentle as we can possibly be, babies still don't love having us in their mouths because it's invasive. And so babies, they'll often fuss. And, of course, I still see the same range of parents that I've always seen, right? So some parents are able to tolerate that a little bit more easily than others. For some parents, it is absolutely too stressful to do it. So for those parents, I'll usually just ask them to change baby's diaper and have somebody put the camera over baby's mouth. And so I can see how baby moves their tongue while they're fussing and crying. And that's not by any stretch of the imagination a full assessment, but it gives me some idea. To know whether there's something there that needs to be looked at more closely. So, you know, the thing is, you got to be creative.
Yes.
You got to be creative and flexible.
Yeah. Do you feel you've also really, you're reminded of returning to the basics? Really important information to be returned to parents, like simple things as, you know, how many, you know, they're questioning if baby's feeding enough. Well, how many wet nappies or diapers are babies having? You know, what's going on with the stools? You know, coloring of stools. These really basic things that sometimes people forget to share. Yeah,
absolutely. And you know, you mentioned my having gone to Australia in February, and part of that training was also infant feeding and emergencies.
Yes.
And there was another one yesterday.
Yes.
So,
that we were listening to. Yes.
This is an emergency. We've been living in an emergency situation for the past 6 months.
Yes.
And one thing we saw happening here in Quebec in particular is many of the pharmacies stopped breast pump rental because they stopped all rental of medical equipment.
Yeah.
So that included breast pumps. So I had moms struggling with supply and they couldn't find a breast pump. So absolutely back to basics. Okay, let's get hand expression going. Let's get baby nursing at the breast with drip drop method.
Yes.
You know, Magdalena Woolery has taught us about that. And it's amazing. It works beautifully. And you don't need equipment. You latch the baby and you drip milk down the breast. Whether it's, you know, express milk or formula, with a spoon, with a syringe, whatever. You know, there's getting creative and going back to basics. Putting all of our gadgets and technology to the side because we can't go get them.
I agree. I think that's a really important, we forget about the very basic tools because we've reached such levels. Even you thought, oh, I need to weigh these babies. The realization is that, okay, one of the general ways is, well, if it's going in, it's got to be coming out, and if it's not, then you've empowered the parents by informing them. If we're not seeing this number of wet nappies or diapers or this number of stools, then we need to look a bit further. So you've got a bit of an idea, and even babies that are feeding often, we need to know that still what's going in is coming out. So and I think that's probably, for me, one of the key factors that I've seen is simply getting away from these massive, idea of using gadgets endlessly. Something that I've been a bit more concerned about as we're doing all these virtual consultations is the influence, because parents are now so much online, is the significant increase in advertising directly to them. And I think that's been a little bit of concern. And so empowering them can make a big difference.
It's maddening because, you know, we do now have evidence that antibodies to COVID have been found in breast milk.
Yes.
So, you know, what we suspected all along, that breastfeeding would offer some protection against COVID like it does almost every other single respiratory virus. Now we have evidence of that. And yes, we have definitely seen just an onslaught of predatory marketing of various companies taking advantage of the pandemic situation. And they're not improving health for babies. No. They're creating a more dangerous situation for babies.
So actually for families altogether.
Yeah, exactly. You know, by moving them away from breastfeeding. It's really, it's very concerning.
Yeah. And I think this is where I would be very interested when we're through eventually all of this situation, even before.
And when will that be?
Or even before we get to that stage, that we actually, you know, that our governments around the world will actually start to question what, you know, the fact by stepping away from supporting families and stepping away from the idea that, you know, looking at infant feeding as a public health imperative, that there's actually been more harm done than good. These are services that are actually and should be considered as essential services. And I hope that we will actually start to see some changes all across the world, but hopefully in Canada and Quebec, definitely.
And just basic education for other healthcare professionals who are working with birthing families who aren't necessarily having lactation as their main role. I mean, we've seen incidences of dyads being separated, even before a COVID infection is confirmed. I've had a number of people contacting me that, and when we look at the public health guidelines that were created in Quebec, they're actually pretty good and they're very clear. They state very clearly that even in the presence of a confirmed COVID infection, mom and baby are supposed to remain together, and breastfeeding is supposed to be continued, it's supposed to be encouraged. But it seems that message didn't reach everybody who is interacting with families. So, I think the pandemic has definitely highlighted the gaps that do exist in public health. Throughout the whole healthcare spectrum, whether it's really from cradle to grave.
I agree.
So I mean, that's, if you want to try to find a positive, I think maybe that is a positive. Like, okay, now we know where our problems are. Let's start
to improve the situation. I agree. Anything else you'd like to share as we close? I think you've done a great job, and I think everyone's going to really enjoy, looking at how to do these virtual consults, because I don't see them going away too soon.
I just completely reorganized my office to make it more comfortable for being online all day. I was reluctant. But I just put all my in-person stuff away because I'm not using it anytime soon. I would say be open, be flexible, be willing to change, be willing to try new things. Families are generally really forgiving if your camera falls or is at the bad angle, or if your whatever platform you're using crashes. Most families are just grateful for whatever help they can get. And they're really tolerant of the bloopers that are bound to happen as you're just getting started. Being online, I do find has offered a fair bit of flexibility for me. If I have somebody who I just need a quick update on, okay, so how did that intervention work for you? We saw each other 3 days ago. Have things been better or not? And what do you see? Is baby finally peeing more? Great. And with being online, I don't have to worry about bringing the family all the way to a clinic or me going all the way to them. It's just like, okay, let's talk at 3:00. And it's they're sitting there in their pajamas, and I just made it out of my pajamas. And
that's okay.
But it does allow for that flexibility. So just, you got to get creative and stay flexible, and it works. It works.
That's wonderful.
Much better than I thought it would.
And I'm really glad to hear that. I think I work online endlessly, so through education, and I think probably one of the things it is important for basically all health professionals to be aware of is also to be kind to yourself, because very often we have such high expectations. We want the best for these families, but it's also important that we take a step away from the screen sometimes, and definitely go for our daily walks if we can, or at least do a bit of exercise in the house if you cannot get out of the house. So that would be
very true. That's very true, because typically when we're doing in-person lactation consultations, we're moving around. We're getting into different positions, we're getting up, we're walking around. When you're in front of a screen all day, you're really stuck. And so schedule in a 20-minute walk each day. You'll come back, you'll be better able to concentrate, and you'll be able to be more present your families that you're working with, for sure. And physically you'll feel better too, because you won't get so stiff.
Yeah, exactly. So thank you so much, Jen. It's been really great talking with you, and I really hope everyone gets to enjoy learning more about virtual consultations.
Thanks, Carol. Take care.